In 2030, exactly 5 years from now, something extraordinary is going to happen. It's not a single technology that will reshape our world. It's 5 distinct revolutions that will converge simultaneously, creating an unprecedented inflection point in human history. And while the media focuses on artificial intelligence, almost no one is really talking about this technological confluence that's rapidly approaching. We're in October 2025. There are exactly 1,925 days left until 2030. Each passing day brings us closer to a moment when artificial general intelligence, brain-computer interfaces, commercial quantum computing, third-generation gene editing, and ubiquitous mixed reality will merge. Not successively, simultaneously. To understand the magnitude of what awaits us, we must first examine each of these technologies individually, then grasp what happens when they meet. Let's start with artificial general intelligence, or AGI. Sam Altman, CEO of OpenAI, recently adjusted his predictions. After announcing AGI for 2023, then 2025, he now suggests that 2030 represents a more realistic timeline. Sergey Brin, co-founder of Google, and Demis Hassabis, CEO of Google DeepMind, share exactly the same prediction. 3 of the world's leading experts in artificial intelligence are converging on the same date. This is not a coincidence. They're observing the same exponential curves, the same algorithmic breakthroughs. AGI won't simply be more powerful AI. It will be a machine capable of matching or exceeding human capabilities in virtually all cognitive domains. Altman predicts that by 2030, between 30 and 40% of tasks currently performed by humans will be automated. The World Economic Forum goes even further, estimating that 92 million jobs will disappear by 2030, while 170 million new roles will emerge. McKinsey estimates that 400 to 800 million individuals worldwide will need to change their professional occupation by that deadline. Meanwhile, brain-computer interfaces are crossing a critical threshold. Neuralink plans to implant between 20 and 30 people in 2025, with a goal of 20,000 annual implantations by 2031. The global brain-computer interface market, valued at $398 million in 2025, is expected to reach $6.2 billion by 2030, according to Grandview Research. This exponential growth is explained by major advances. Ongoing clinical trials demonstrate that these devices already allow paralyzed individuals to control computer cursors through thought, regain speech, and even walk again. By 2030, the commercialization of these technologies will no longer concern only medical applications. We will enter the era of elective cognitive enhancement. Imagine being able to communicate directly with a computer through thought, without a keyboard, without a touchscreen. Imagine downloading knowledge directly into your cortex, like downloading a file. Quantum computing, long considered a distant promise, is also reaching maturity. IBM and Google recently announced decisive breakthroughs that pave the way for commercial quantum systems by 2030. IBM published a detailed plan in June 2025 to build a fault-tolerant quantum computer by 2029. Google, for its part, demonstrated a major advance in large-scale quantum error correction at the end of 2023. These machines won't be simple, faster computers. They will solve problems currently impossible to handle. The discovery of new drugs, which currently takes 10 to 15 years, could be accomplished in a few months. The optimization of complex networks, precise molecular simulation, the decryption of systems currently considered secure, everything will become possible. The Quantum Insider estimates that by 2030, 2,800 leading companies will use quantum computing as a cloud service. Fortune Business Insights projects that the market will grow from $928 million in 2024 to $6.5 billion in 2030. Meanwhile, biotechnology is also taking dizzying steps. CRISPR, the gene editing tool that revolutionized biology, is entering its 3rd generation. In 2025, the FDA approved Casgevy, the first CRISPR-based therapy, opening the way for personalized treatments for cancer, HIV, sickle cell disease, and neurodegenerative diseases. But this is only the beginning. By 2030, personalized gene editing will become an accessible medical option. Stanford Medicine recently developed CRISPR-GPT, a language model that significantly accelerates gene editing processes by making them more precise and accessible. The convergence of artificial intelligence and CRISPR is radically transforming our ability to modify living organisms. Finally, mixed reality, this fusion of the physical and digital, will also reach a tipping point in 2030. Today's heavy and bulky headsets will give way to lightweight glasses, indistinguishable from ordinary glasses. Spatial computing, this ability to interact with digital objects in three-dimensional space, will become as natural as using a smartphone today. But what makes 2030 truly unique isn't the existence of these 5 technologies, it's their convergence. It's the moment when they will meet and multiply each other. Let me show you concretely what this means. Take medicine. Imagine a patient with Parkinson's disease in 2030. A brain-computer interface implanted in their cortex detects abnormal neural signals in real time. An artificial general intelligence analyzes these signals with precision infinitely superior to that of a human neurologist. A quantum computer instantly simulates thousands of candidate therapeutic molecules. Third-generation CRISPR allows editing of the defective genes responsible for the disease. And this entire process is visualized and controlled in mixed reality, allowing the doctor to literally see and manipulate the patient's neurons in three-dimensional space. This is not science fiction. Every element of this scenario is based on technologies in active development today. Or consider intellectual work. In 2030, a researcher equipped with a brain-computer interface will be able to formulate hypotheses through thought. These hypotheses will be instantly processed by an AGI that will explore millions of scientific publications in seconds. A quantum computer will perform complex simulations impossible today. And the results will appear in the researcher's three-dimensional workspace, manipulable like physical objects. Cognitive productivity will no longer be limited by typing speed or reading capacity. It will be directly connected to the speed of thought. Education will undergo an equally radical transformation. Imagine a surgery student in 2030. Rather than reading textbooks and watching videos, they will put on mixed reality glasses and see appear before them a complete human body, anatomically perfect, derived from ultra-precise quantum simulations. An AGI will accompany them as a personal tutor, instantly adapting to their learning pace, identifying their weaknesses, adjusting exercises. And if necessary, a brain-computer interface could one day facilitate the direct acquisition of certain motor skills by stimulating the appropriate neural circuits. The time needed to train an expert surgeon could go from 15 years to 5 years. But this convergence raises deeply troubling questions. Let's start with the most obvious: inequality. A brain-computer interface will cost approximately $50,000 according to Bloomberg, once insurance fees are included. Who will be able to afford this cognitive enhancement? Who will have access to personalized gene therapies, to medical consultations assisted by quantum computers? We are heading toward the creation of a new social class: augmented humans. Those who have access to these converging technologies will have cognitive, medical, and professional advantages so considerable that the gap with the non-augmented will become a chasm. Currently, more than half of the world's population doesn't even have access to high-speed internet. How will these billions of people react when a privileged minority begins to merge with machines? Then there's the question of privacy and mental autonomy. A brain-computer interface capable of reading neural signals to control a cursor can also detect your intentions, your emotions, your thoughts before you even consciously formulate them. Who will own this neural data? Current governments don't have a unified legal framework to protect this type of information. Brainjacking, this ability to hack a brain-computer interface to access thoughts or even influence decisions, is no longer science fiction. Researchers have already demonstrated security vulnerabilities in current devices. Imagine an advertisement that doesn't just target you based on your browsing history, but adjusts its message in real time based on your neural reactions. Imagine an employer who detects your level of cognitive engagement during meetings. Imagine an authoritarian regime that monitors dissident thoughts before they even transform into actions. Massive job displacement constitutes another major threat. McKinsey predicts that by 2030, up to 30% of hours currently worked in the United States could be automated. Goldman Sachs estimates that 300 million full-time jobs worldwide could be affected by AGI-driven automation. It's not just repetitive manual jobs that will disappear. AGI will excel in complex tasks: medical diagnosis, legal analysis, computer programming, content creation. Intellectual professions, long considered safe from automation, suddenly find themselves on the front lines. Certainly, 170 million new jobs will emerge according to the World Economic Forum. But these jobs will require radically different skills. 375 million workers will need to retrain by 2030. The question is not simply economic, it is existential. What will be humanity's place in a world where artificial general intelligence, augmented by quantum computing and connected to billions of humans via brain-computer interfaces, performs the majority of cognitive work? And then there's the most dizzying question of all, the very nature of intelligence and consciousness. When a significant part of your cognition is delegated to an AGI connected to your brain, where will your mind stop and the machine begin? When your memories are stored not only in your biological hippocampus, but also in a quantum cloud, who are you really? Philosophers have debated the nature of consciousness for centuries. In 2030, it will no longer be a theoretical debate. It will be a practical question affecting millions of people. Yet, despite these dangers, the potential is staggering. The convergence of these technologies could solve problems that seem insoluble today. Climate change could be mitigated through ultra-precise quantum simulations, identifying new materials for energy storage and carbon capture. Neurodegenerative diseases that afflict tens of millions of people could be cured through the combination of brain-computer interfaces, diagnostic AGI, and gene editing. Scientific productivity could explode, enabling breakthroughs in nuclear fusion, human lifespan extension, even space travel. Sam Altman states that AGI will unlock major scientific discoveries and enable optimal management of complex societal systems. So how do we prepare? 3 concrete strategies emerge from current research. First, develop intrinsically human skills that AGI will struggle to replicate. Original creativity, deep emotional intelligence, complex ethical judgment, interdisciplinary systems thinking. The jobs that will survive in 2030 will be those requiring these capabilities. Second, cultivate cognitive adaptability. Professional retraining will no longer be a one-time event in a career, but a continuous process. Learn to learn quickly. Familiarize yourself with emerging technologies even if they don't directly concern your current field. Third, engage in ethical and political debate. The decisions made between now and 2030 regarding the regulation of these technologies will determine whether their convergence benefits all of humanity or widens existing inequalities. Your voice matters. Laws on neural data protection, equitable access to cognitive enhancements, economic redistribution in the face of massive automation. All of this is being decided now. 2030 is not a distant horizon. It's exactly 1,125 days away. Less time than it takes to get a doctorate. Less time than it takes to pay off most mortgages. While you're listening to this video, researchers at Google are perfecting quantum error correction. Engineers at Neuralink are refining neural decoding algorithms. Biologists are using CRISPR-GPT to design the next generation of gene therapies. IBM is building the components of its fault-tolerant quantum computer. And OpenAI is training artificial intelligence models increasingly close to AGI. The convergence is approaching. It is neither inevitable nor stoppable, but it is shapeable. The question is no longer whether these technologies will merge in 2030. They will. The real question is, will you be prepared? Will you understand the stakes? Will you participate in the decisions that will determine whether this convergence elevates all of humanity or creates an irreversible fracture between the augmented and the non-augmented? History teaches us that major technological transitions are moments of danger and opportunity. The Industrial Revolution created unprecedented prosperity, but also massive inequalities and social upheavals that took generations to resolve. The digital revolution connected us globally, but also generated mass surveillance and political polarization. This 2030 convergence will be different in scope and speed. It won't be a single revolution, but 5 simultaneous revolutions, each amplifying the others exponentially. There are 1,125 days left. Every day counts. Every decision counts. Every voice counts. The convergence is inevitable. Its consequences are not.